people who are dying. So many people are in need of treatment.
We got interviewed by the press here, and they asked us to compare the healthcare state of the United States versus the healthcare system here. And my answer was that I didn't see a healthcare system here.
When you look at the burden of disease here, there's just so much more than it is in the United States. In the United States, even if you're in the middle of like rural North Carolina, you can pick up your cell phone and call 911 and someone will come get you and give you help. And that does not exist in Nigeria.
The people of Nigeria need access to the same basic health care that we have. They have access to nothing.
There's just not a health care system for the indigenous people here. I feel like there's an upper class and then there's poverty here.
I had an awakening. People who are suffering and dying needlessly aren't some people on some late night infomercial, but are my cousins and aunts and uncles and friends of my father and my mother. We reached out to doctors in Charlotte, North Carolina, doctors in Denver, and staff in Chicago. We put together a great team. And we are here at Regina Chaley Hospital, a Catholic missionary hospital in Awka. And as I speak, the doctors are replacing hips and knees and really transforming lives.
Everybody was surprised. Then where they work, not getting tired. Dedication, they have really contributed a lot. We appreciate it much.
In this part of the country, coming for bone surgeries, we haven't heard of that before. I haven't heard of that before. So this is the first of its kind.
What is this bandage here for?
We were asked to assess this girl. She came in complaining of her right knee hurting. The right knee was bandaged, but when she pulled her skirt up, her left leg was so disformed from polio. It just took me away. I'm like, I would expect that her left leg would have been her issue, and it was her good leg.
You don't see that in the U.S. That kind of deformity early as a kid would have been picked up and sent to the right person.
Our major problem in Nigeria is the resources. We don't actually have the resources.
Well, first of all, you walk in the theater, which they call their operating room, and it's like, are you kidding?
You can't even imagine what crossing your T's and dotting your I's looks like in a place like this, because there is nothing here except lights and a table.
My father had told me about this dream of his, to build a world-class hospital back in Nigeria.
When we have the Augustine Memorial Hospital built, we'll be able to expand our services beyond just orthopedics and extend care to those who can really ill afford it.
The exciting part about being here at this future site of our hospital is that right now, we're on a medical mission, probably about 20 minutes away from here, but I can't wait for the day when doctors from Chicago and Los Angeles and New York are going to be packing up and getting their supplies and their equipment together and coming to medical missions here at Augustine Memorial Hospital. And that should be, God willing, only a few years from now.
As we are planning the Augustine Memorial Hospital, we felt that there's a need to begin to show that we can help those who really cannot afford to pay for certain medical procedures. The fact that we've been able to offer surgery to people who have been limping around for years, some of them have been limping for up to 12 years, and have just yesterday had their surgery done. I think that's the most gratifying thing I have seen.
It's more about a mission to develop and be a blessing to these people.
We're not saying we're going to be able to solve the problems of this country, but at least they should get the medical care that they deserve here. That's what GEANCO stands for. We are here to help you.